Hi, everyone, and thank you for joining us today for our webinar, Seizure Recognition and First Aid, presented by the Epilepsy Alliance of Ohio. My name is Kelly Blount, and I'm the Program Marketing Specialist here at General Electric Credit Union. We're so glad you've joined us as we have a lot of great content ahead, and we wanted to thank you all for tuning in from the comfort of wherever you may be today. And with that, I'm going to turn this over to Allison Rone to introduce herself and take us through today's topic.
Hi everyone, I'm Allison Rone. I'm Community Educator for Epilepsy Alliance Ohio. I've been here since May, but I've been around the agency for a really long time. We run a kids camp, so that was my introduction. I was a camp volunteer when I was in high school and college, and then I became their administrative assistant after I graduated college, and then I went to be a probation officer for Hamilton County for 9 years. So I'm glad to be back and glad to be in this role and excited to share our information with you today. So a little bit about us. We're a nonprofit. We're based in Cincinnati, but we have an office up in Columbus as well. We provide services and programs for people living with epilepsy. All of our services are free of charge, as well as no insurance or copay, anything like that. We are grant funded and do our own fundraising events, so that is how we are able to support these programs. So first and foremost, the service that we offer is obviously the seizure recognition and first aid. We provide this service free of charge. It's always an hour, and we go to schools and law enforcement and community agencies, families, really anyone who's interested in learning more about what to do if they were to witness a seizure. We are able to provide that resource. We also offer counseling services, again, free of charge or insurance. We can do that on the phone, in person, or virtual. Our counselors are in office in Cincinnati, so in person would be best if they're here, but we can also accommodate accessibility issues. We offer advocacy within the school system, criminal justice system, and workplace, so we ensure no one's rights are being violated. We can come and assist at IEP or 504 meetings. We can attend court proceedings if they were to maybe have a seizure while they were driving, or have a circumstance with police in the community during a seizure. We're able to come and help them out, as well as if they were to get fired for having a seizure on the job, anything like that, we're able to provide that resource to them, again, free of charge. We offer CEU training seminars once a month here at the Cincinnati location. They are ran out of Brookwood Commons, if you're familiar with the area. It's once a month. The topics vary, so if you are in need of CEU credits, please visit our website and get that list. They change once a month, and all that information is on our website. We also offer just general information and referral services, so we get lots of calls daily of people just having their first seizure and don't really know the next steps, and we are here to help them. So people calling in asking for a neurologist or what they should do, or just even more support. We offer art therapy, as well as we run a kids camp that is ran. It is called Camp Flamecatcher. It is ran out of Camp Kern, a couple exits north of Kings Island, if you're familiar with the area. And it is a summer camp for a week in July, and then we offer 2 weekend camps, one in the fall and one in the spring. What sets our camp apart from other kids camps in the summer is that all of our counselors are trained on how to respond to a seizure. So the kiddo and their families can feel comfortable that they're going to be taken care of. There's a nurse on site 24/7, administers meds, is also there for any other needs. We can offer more one-on-one if there are other needs other than their epilepsy. We've had kids of all backgrounds and circumstances, so we would love to have them. This is the only service that we charge for. However, we do a lot of fundraising during the year to provide scholarship opportunities for kids who may not be able to afford to come. That should never be a barrier for them to get to have a fun time. So we would be able to help them. So if you want any further information on this, I'll put my email in the chat at the end. Feel free to email us, and we can give you more information on that. We also operate 4 group homes for adults living with developmental disabilities out in Claremont County in Ohio. They do not have to have an epilepsy diagnosis to live there. They just have to have a qualifying developmental disability diagnosis working with DODD. We do have beds available if there's anyone in need of housing. We also offer scholarship opportunities for high school seniors going into college, but also if they're already in college, if they're already freshman, sophomore, junior, senior, they can still apply every year. All we really ask for that is for them to write a short essay on how their epilepsy has impacted their life, recommendation letter from a mentor, their high school transcripts, and a letter from their neurologist, just really confirming that they have epilepsy. And again, further information on all this is on our website. That'll be at the end if you want to get more information on that. We also operate support groups. They meet once a month. In a post-COVID world, they meet virtually. There are some in-person ones as well, but most of them are going to be online, which I think is great for accessibility. You don't have to be an Ohio resident to attend. You could just, if anyone who needs support. So we do split them up based on ages. So we do have a teens group, which is very well attended. We have a transitional age one, so that about 18 to 24. And then we have an adults one. But not only do we have support groups for people living with epilepsy, we also have support groups for parents of a child with epilepsy. So it gives them a safe space to meet other people who are going through similar situations and help with coping skills and just get support from other people that know what they're going through. But we also have a specific moms support group as well, if that's something you'd be interested in. On our Facebook page, we post when those are being held and you can attend. It gives you all that information. Last but not least, we have a SMART program. The acronym is kind of silly, so I'm not going to elaborate on what it means because it doesn't make any sense. But basically what it is a once a week program for 8 weeks. They meet for an hour and just goes over coping skills for mental and physical well-being while living with epilepsy. Right now, the program is geared towards the transitional age of 18 to 24, and then I do believe we're starting another one in January. I'm not quite sure of the age ranges, but again, this will be on our Facebook page and our website when that time comes. So if you're interested, please look us up and we would be happy to have you. So today we're just going to recognize common seizure types, causes and prevention of seizures, and then just we use the words first aid because by definition that's what it is, but really it's more of a response to how you can make them more comfortable during their seizure. So what is epilepsy? Epilepsy is a disorder that briefly interrupts the normal electrical activity in the brain, causing a seizure. A seizure happens when many neurons fire at one time, causing an electrical storm within the brain, which changes sensation, consciousness, behavior, or movements. So we like to explain this as electrical storm because basically what it is. So for an example of showing you what this looks like inside the brain. So if you were to tell someone to raise their hand and their hand raises, their brain is sending all these neurons down to their hand, instructing it to raise. However, when those neurons misfire, they don't go to the hand, this is resulting in a seizure, and that can affect different things such as behavior, consciousness, sensation, or movement, which is the seizure. So epilepsy is the disorder, whereas seizure is the symptom. So sometimes you'll hear these interchangeably, someone saying epilepsy and then seizures, or seizure disorder, epilepsy. That's the main difference. Seizure is just the symptom of the epilepsy diagnosis. Just some statistics for you. Approximately 3.4 million Americans currently have epilepsy. Roughly 200,000 new cases of seizures in epilepsy are diagnosed each year. 1 in 10 people will have a seizure at some point in their lifetime, whereas 1 in 26 people will develop epilepsy in their lifetime. So the difference between those is you don't have to have epilepsy to experience a seizure. There can be numerous factors in why someone would have a seizure, but that doesn't mean that they're automatically diagnosed with epilepsy. The epilepsy diagnosis comes typically after 2 or more seizures within a 24-hour period, as well as just extensive testing that gets done. So that's the difference between that. So it's great that you guys are taking the time to take this training because you really don't know when you or a loved one could be experiencing a seizure. So it's great to have this information for you. Reduce a little bit of that panic. 50% of people with epilepsy develop seizures by the age of 25. However, anyone can get epilepsy at any time. And one last staggering statistic for you, epilepsy is more common than cerebral palsy, Parkinson's, muscular dystrophy, and MS combined. So all the people living with those diagnoses, there are more people living with epilepsy. Some myths and facts you probably have heard within pop culture or just passed down from generations. We're going to debunk some of those. Most seizures are not going to be medical emergencies. Again, this is a brain disorder, and seizures are just part of what happens. Most of the time, it's just going to be routine, but we will go over the times when it's not routine. Some people may not be aware that they're having a seizure and may not remember what happened. So if something were to happen during that seizure, they may not remember what happened. So not hold a grudge on them while they're in their seizure. And we'll get into more detail about that in a little bit. Epilepsy is not contagious. You are not going to catch epilepsy from loving someone with epilepsy, touching somebody with epilepsy. We try to stress this a lot to school-age kids because you'll hear people not want to be friends with them anymore, things like that. But that's not the case. Doesn't really change them as a person just because they have the diagnosis. Epilepsy is also not a form of mental illness. It is a brain disorder. It is not a mental illness. There's a difference. When I was a probation officer, we would have to go through people's medical, so like substance use histories, mental health history, things like that. And when we'd ask about their mental health is when they would conveniently let us know that they have epilepsy. So it can get confused as that. People living with epilepsy are statistically more likely to experience mental health illnesses. However, epilepsy is not a mental illness. A person cannot swallow their tongue. I will probably reference this several more times today. When I go to community events, it never fails. At least one person comes up and tells me, oh, put a spoon in their mouth, right? Please don't do that. You're going to ruin their teeth. Don't put anything in their mouth, as well as it's not physically possible to swallow their tongue. It probably comes from a good place of wanting to protect their airway, but that is not a good practice and is just going to create more harm to them. Also, last but not least, epilepsy is a medical condition that needs to be treated by a neurologist. So we hear in certain cultures that epilepsy is pretty taboo. They believe it's the devil possessing them. That is not the case. This is a medical disorder that needs to be treated by a neurologist. Okay, so how do people get epilepsy? So for 30% of people, we know why they have epilepsy. The main cause is going to be brain trauma or injury. So car accidents, riding bikes or motorcycles without a helmet, getting in an accident, falling off. Trampolines is a big one too. Different things that would potentially cause traumatic brain injury. Brain lesions or tumors, poisoning, infections of the brain like meningitis, or just abnormal brain development in the womb. But for 70% of people, we don't know why they have epilepsy. We can obviously suspect that it's genetic based on DNA makeup, but we don't know the exact situation of what's going on there. That's why there's agency like us and others that are doing research to find that out and to get more specific information to hopefully start to get a cure. So today we're going to go over 2 different types of seizures. There are over 20 different types, and people can have more than one type. But the 2 most common types of seizures are going to be the generalized seizures and the focal seizures. So for my visual learners out here, I think this graphic is fantastic. Focal seizures only affect a part of the brain, whereas generalized seizures affect the entire brain. What's interesting about the focal seizures is depending on what part of the brain is being affected is what you'll see physically occur. So for instance, if that's more of like affecting the occipital lobe that controls vision, you might see eye fluttering, blinking, things like that. Or if they're going for like the temporal lobe or different lobe, it just depends. So I find that very interesting that that's what you'll see depending on what part of the brain is being affected. Generalized seizures, these are going to be your tonic-clonic or your grand mal seizures, what you most associate with epilepsy, as well as the absence seizures, which we'll get into the difference and what those look like in a little bit. So those are the basic differences between the 2. And again, there are over 20 different types. So these are just the two most common. So we'll get into the focal seizures first. So this first mouthful is focal onset impaired awareness seizures. They're also better known as complex partial seizures. So people with these type of seizures, their awareness is impaired and they're not going to be able to respond to you. So they don't know what's happening and they don't know what you're saying to them. So that's really important to remember when seeing this. It's great to talk to them while they're going through the seizure, but just know that they're not going to be able to respond to like commands or different things like that. It's going to start with a blank dazed stare, and they may have some automatisms or those repetitive purposeless movements. So maybe pulling at their clothes, blinking, lip smacking, different things like that. They might appear clumsy or disoriented, aimlessly walk around the room, randomly picking things up, again, having lip smacking or nonsensical speech. These typically are only going to last 1 to 3 minutes, and afterwards, they're not going to feel too good. They're going to be pretty tired, maybe have a headache or be nauseous. After all, this is a brain disorder. Their brain is going through a lot of electrical activity, so that's why they're not going to feel too good coming out of that. What's really important to know about these type of seizures is that they can become combative if they're restrained. So while I was a probation officer, one of my clients entered the criminal justice system because he was having one of these seizures in the community. And unfortunately, the police officer was not aware of that and tried to restrain him. He obviously got combative at this time and unfortunately was tased. So if they would have just given him a couple more minutes, he would have came out of it and been his normal, lovely self. But unfortunately, that was the situation. So that's why we're here and educating. So it's great that you guys are all out here and receiving this information. We really appreciate it. People with this type, it can look like drunkenness or drug abuse or aggressive behavior. So it's important to time it, check the time. If it's going to be 1 to 3 minutes, just kind of let it work itself out. Just kind of be there for them. Just definitely don't restrain them. So the next type of focal seizure is the focal aware seizures, also known as simple partial seizures. These differ from the complex partial because people with this type are conscious. They are aware of what's going on. They're probably going to be sweating. A lot of people say that they feel a tingling sensation like in their fingertips. Their pupils are going to become dilated. They may say that they're having hallucinations or it's like see, hear, smell things that aren't there. They might talk about an aura, like I get migraines and I have an aura, so where it's just like a little dark spot in my vision and then it just gets bigger and bigger until I can't see anymore. So that's pretty similar to what they're experiencing during the seizure type, or they'll see like a bunch of colors. They may have like deja vu or say that they're having visions or talking to people that aren't there. Harriet Tubman was known to have epilepsy. It was documented that she would have visions and be speaking to God, but after further research, it determined that she was actually having seizures. Sudden emotional changes can occur, so having fear, joy, anger, these emotions are going to change really, really quickly. They could also have the rhythmic movements, the isolated twitching of the arms, legs, face, the fluttering eyes, or a lot of blinking, lip smacking, things like that can also occur. Again, remember that the neurons are misfiring, so that's what is causing these rhythmic movements. People with this type of seizures, they typically last less than a minute. So silver lining is that these are happening pretty quickly, typically. So now we're getting into the generalized seizures. So again, these are the ones that are affecting the entire brain. So absence seizures or absence seizures, depending on how you want to pronounce it. This is a brief loss of consciousness, which lasts for only a few seconds. So although these are only occurring for a little bit of time, they can happen a lot. So while they're going through this, they are having their brief lapse of awareness, so they are not aware of what's going on during those seconds of this occurring. So while it's only a couple of seconds, if this is happening like hundreds of times a day, they're going to end up missing hours of their day. So it's really important to keep aware, especially in children. These are very common in children. Very important to kind of keep an eye on. It starts off like they're going to stare vacantly. Their eyes can flutter, or maybe have a head movement. Again, they're going to have the lapse of awareness, so they're not conscious at this time. They don't know what's going on. They could have chewing or blinking, and again, they can occur many times a day. This can look like daydreaming, lack of attention, ADHD, or behavioral issues. So just something to keep in mind if you are seeing young kids or even adults that might stare off for a couple seconds and then kind of come out of it, and they automatically go into whatever they were doing prior to their seizure. So if they were in the middle of talking, they'll just finish their sentence, or if they were passing out a paper, they'll finally let it go. So different things like that, if that's good examples. I do have videos showing the difference between the absence seizure and the complex partial. So you can kind of know the difference of what those look like, because I wasn't really sure what they look like until I started and I watched these videos. So for all my visual learners, we have examples for you. Atonic seizures, again, this is a generalized seizure. These are better known as drop attacks. These happen very quickly. It's just going to be a sudden collapse and fall of a person. Their body stiffens and they're going to lose muscle control. So these are really quick. They're just going to drop and then they'll be able to get back up. Okay, so tonic-clonic seizures. These are also known as the grand mal seizures or convulsions, and what you're going to most associate with epilepsy. So people with this type, they're going to lose consciousness immediately and fall. So the tonic refers to the stiffening of the muscles, whereas the clonic refers to the rhythmic jerking of the head, legs, and arms. The reason the names keep changing is because we're getting closer and closer to identifying what's going on in the brain. So it's a good thing, although frustrating when trying to explain what they are, because people would be like, I thought this was grand mal. So that's the difference and why the name has changed. They're going to have shallow breathing and potentially have drool. Justin Fields, he was the quarterback for Ohio State, now the Chicago Bears. He has tonic-clonic seizures. He has epilepsy, and he would describe himself as foaming at the mouth. So that's another thing that you might hear people say when they're going through these tonic-clonic seizures. They could potentially lose their bowels or bladder control. So if you do have a kiddo with this type, maybe sending him to school with spare clothes would probably be great. We don't want to have any further emotional struggles from having their seizures. These types of seizures typically last 1 to 3 minutes. It's probably going to feel like a lifetime, but most of the time they're going to be standard 1 to 3 minutes. Obviously, this is going to change person to person. Some people, it might be normal for them to have 5 minutes, but that's something that is particular to them. But typically, it's going to be 1 to 3 minutes. After these seizures, again, their brain is going through a lot at this time. They're not going to feel too good and probably want to go home and lay down for a bit. They're going to be confused, exhausted, have headaches, soreness, or even some speech difficulty. So it's important to just be cognizant of that and provide emotional support and not really take things to heart. If any of these type of seizures really happen, just kind of bearing through it with them. Okay, so the seizure triggers of precipitants. So these are, most of the time, people living with epilepsy are going to be pretty well regulated on anti-seizure medications. 70% of people, that's what's going to be super effective in reducing the likelihood of them having a seizure. However, there are times where seizures could happen, and we refer to these as breakthrough seizures or the seizure triggers of precipitants. So reasons that people might have a breakthrough seizure are these. So number one is going to be missed or late medications. It is very important for people living with epilepsy to stay very well regulated on their medication. So waking up late and taking it late, or not taking it because just like with mental health medications, oh, I feel better, I haven't had one in years, I don't need to take it. That's what happened with Justin Fields. His mom grew out of her epilepsy through her puberty stage, and he thought that was going to happen with him. So he took himself off of his medication and immediately had a tonic-clonic seizure. So it's very important to stay regulated on their medication unless consulted with a neurologist. They could have just side effects. A seizure can happen due to side effects of their medications. Flashing lights, obviously this is a pretty common one. You'll see the trigger warnings on movies or at haunted houses. That's not going to be the case for everyone with epilepsy, but it can be. So important to know if they're at school with like the fire alarms, or if they're at a workplace with fire alarms, if this is a potential trigger for them, just having a plan in place if there was to be a fire drill to get them out safely without inducing a seizure. Stress or anxiety is a very common reason. Just the toll that it takes on the brain can trigger a seizure. Hyperventilation, so those panic attacks. Lack of sleep or fatigue. As we know, sleep is very important for rejuvenating the brain every day. So someone with a brain disorder not getting that rejuvenation is going to really affect their seizures. Hormonal changes. So again, you hear a lot of kids growing out of their seizures at puberty age. They're becoming more chemically balanced in the brain, but also people becoming imbalanced, and that's when they're getting diagnosed. So it could go either way, but it also relates to women and their menstrual cycle. As if there wasn't enough to deal with the menstrual cycles, that can trigger a seizure as well. Just general illnesses, alcohol or drug use, drug interactions from like over-the-counter medications. So for most anti-seizure medications, alcohol is going to be a no-go. It's not going to work well with, it's basically going to make their anti-seizure medication ineffective. So it's important to check labels if you're taking over-the-counter like cough syrup. A lot of ethanol is in those medications like NyQuil, as well as cough syrups. So just making sure ethanol is not in there, or just talking to the neurologist of what's a good, safe one to take for them. High energy drinks, obviously with that high caffeine content, that is going to affect the brain in the imbalance. Overheating or overexertion, so that's where you'll see a lot of seizures, like with fevers, especially my nephew had one when he was a baby. He had a high fever, it resulted in a seizure. He didn't get diagnosed with epilepsy, so again, that's the difference. But overheating can definitely trigger a seizure. And that is why our kids camp, they stay in cabins that are air conditioned. So we want to definitely avoid this at all costs. Poor diet or missed meals, overall changes in health, and vaping has officially made the list. So it's important to remember, just like autism, epilepsy is a spectrum disorder. It is very specific to each person. So what may work for one person you know with epilepsy may not work for someone else. So it's important to be cognizant of that and to not get frustrated, be like, well, if this worked for this, like, why doesn't he try to do that? It just may not work for them. Maybe they did try and it just doesn't work for their specific type of epilepsy. Because again, they can have more than one type of seizure, and different things work for different people. That's why there's so many anti-seizure medications out there and so many different treatment options. So I know this can sound really overwhelming and daunting, but just because there's an epilepsy diagnosis doesn't mean that they're not capable of great things. So it's important to bring that fact up, especially to people who are just diagnosed and probably feel really overwhelmed and might be going through some mental health issues. So just some famous people who've done some great things that have epilepsy. Vincent van Gogh, a famous artist. We got two presidents, Teddy Roosevelt and Franklin Delano Roosevelt. Again, Harriet Tubman and Justin Fields, who I've spoken about. Alan Faneca, he played for the Steelers. Prince, Danny Glover from Lethal Weapon. Lil Wayne, Sir Elton John. Florence Griffith Joni, or Flo-Jo, the fastest woman on earth. And Adam Horovitz of the Beastie Boys. This is not a comprehensive list. These are just enough to fill the slide. So there are way more people. So it's just important to remind them and stay positive that they can still achieve their goals or modify their goals to get to what they want to go. So some first aid, we'll finally get into why we're here, what to do if you were to see a seizure. So we'll start with the tonic-clonic seizures, and then we'll go into the focal seizures. So we created this acronym to make it a little bit easier to remember of what to do if you were to see someone with a tonic-clonic seizure or the grand mal seizures, or the convulsions. So the first thing we're going to want to do is turn them on their side. That's what's going to prevent any secretions that come up from getting caught in the throat and choking, as well as just being able to get them out. So that's very important. Next, we're going to remove objects or glasses. So if they're wearing glasses or a mask, or even like a tight scarf, we want to get that off to make sure we're getting as much air coming in as much as possible, because again, their airway, they're going to have some shallow breathing during this time. As much as we can get into the lungs and brain as possible. Next, we're going to use something soft under their head. Obviously, in an ideal world, a pillow would be perfect, but most of the time that's not what's going to be happening. So just your lap would work fine, a puffy coat, even if you just want to cradle the head with your hands, just making sure you're keeping your fingers away from the mouth, because there is a possibility for a bite. So just gently cradling the head, not forcing their head in one place, but just making sure it's not slamming into the ground or table. We just want to protect the brain or the head as much as possible to prevent any further injury. Then we're going to stay calm and stay with the person. I know staying calm is going to be, it sounds a little silly, but it can make things go a lot more smooth if we're staying calm. Because obviously, if you've not seen one and it's the first time you're seeing one, it can be very scary. Even after seeing several, I still get nervous and stressed when I see one myself. So staying calm and giving people jobs is very helpful for the person. So if we want to have someone stay with them, like maybe comforting their head, saying comforting things to them, maybe other peoples that are wanting to help but don't really know what to do, creating like a human barrier around them so looky-loos aren't staring and recording them. That can be really helpful to the person once they're coherent, or when they're conscious. If you want to have someone go and get EMS and have them direct them through either the building or to the person, just giving people jobs really helps the situation stay controlled. And not too many people in their face. And last but not least, we're going to want to time the seizure. So it doesn't have to be an exact science down to the second. If you look at the clock and it says 1:35, great, just keep track of that. We don't want it to get over the 5-minute mark. So once it gets to be like 1:37, we want to make sure that that seizure is ending. But it doesn't have to be an exact science. Just check the time and then check it when you feel like they're regaining their consciousness. Things not to do. Again, we don't want to put anything in their mouth. I met a retired EMS employee at Mount St. Joe a couple of months ago, and he said that back in the day it was protocol to put a one of those wooden tongue suppressants in their mouth, but it would just break everyone's teeth. So we don't want to put anything in their mouth. It's just going to create more problems for them and potentially a bite risk for you. So just staying away from the mouth would be great. Don't give them anything by mouth. So don't give them any water or food, or typically no oral medicine is going to be swallowed. There's a potential for a choke. We don't want to give them anything that could potentially make them choke. And last but not least, we still don't want to restrain them. Their muscles and their bodies are already going through a whole lot, so forcing them to stay straight and trying to stop the convulsion is not going to make them feel any better. It's just going to create more injury, or potentially create an injury to you. So we don't want that to happen. So just kind of let them get through it, comfort them, but don't restrain them. Okay, so for the focal seizures, so these are the ones where you're not going to really have too much of a physical cue that they are having seizures. These are going to be more like blank stares, maybe aimlessly walking, things like that. So we still want to stay calm, reassure others. So, hey, I think they're having a seizure, just get out of their way. Just We still want to track the time. If you don't know this person, check for a medical ID bracelet. This can also work for someone going through the tonic-clonic seizures. If you're able to, obviously if they are convulsing, it might be difficult to be able to check that, but afterwards for sure. But for the focal seizures, you can check for a medical ID bracelet. It'll probably tell you instructions, maybe even an emergency contact to call. We definitely don't want to restrain people with this type of seizure, so especially if they are aimlessly walking around, like unfortunately what my client experienced. It's just going to create some aggression that's really not in their personality or their character. So we don't want to provoke them. So if they are aimlessly walking and you see them like maybe walking into traffic or into like sharp corners, we want to still keep them safe. You can just gently tap their shoulders. And again, I'll show you a great example of what to do during this type of seizure in a little bit in our video. So you can gently tap their shoulders in the right direction. It's going to look a little like sleepwalking. So even just like sheep, like like a sheepdog. So just gently like using your body, like letting them bump into you like a bumper car. It'll keep them away from going into hazards. Again, don't expect people in this type of seizure to obey verbal instructions. So telling them, hey, look out. They're not going to hear you, especially with the complex partial seizures. They're not going to be conscious during this time. We still want to stay with them until they're fully alert and aware. So these happen pretty quickly. These are only going to be a minute or less. Maybe 3 minutes for the complex partial, but typically about the 1 minute mark. We still want to stay with them, make sure that they don't go into another seizure, which is known as a cluster seizure. So we definitely want to stay with them and make sure that they become conscious. If the seizure lasts 5 minutes beyond what is routine for them, follow emergency protocol if you're at an agency, but if not, definitely call EMS. If it's getting beyond that 5 minute mark, that's what can cause further brain injury, going that long without having that suppressed breathing, as well as just the seizure shouldn't typically last that long unless it's normal for that specific person. So if you were to see a seizure in an individual in a wheelchair, we don't want to remove them from the wheelchair unless it's necessary. So if they're not being restrained by a seatbelt, we want to keep them in their wheelchair. However, if they're starting to slouch down and their airways kind of not, what's the word I'm looking for? If their airway is if their face is down towards their chest, we definitely want to get them down and on their side. But typically, if they're already restrained, we just want to lock the wheels, keep them in their wheelchair. If you're able to fasten the seatbelt, that would be great. If you're not able to get there in time, it is okay. Just make sure that they're not slumped into their wheelchair. We just want to protect that airway. So get them on their side if that's what happens. That's okay. We still want to support their head. So if they are staying in their chair, just make sure that their head isn't slumped all the way down to their chest. And we don't want it to be slumped all the way back either, because that can be a choking risk. So just if you're able to, just get it to their side or just keep it a little upright, just making sure that there's enough air getting through. Again, if they're we still want to take off any mask, scarf, glasses. We just want to keep that away from making sure that their airflows is good. If they're able to, if they have seizures, their wheelchair is probably going to be padded. That probably wouldn't be up to you unless you have someone living with epilepsy and would like to pad their wheelchairs. You could do that to protect their limbs. And then we would just follow the regular TRUST acronym. So again, getting them on their side, protecting their head, moving sharp objects, timing it, everything like that. Some other ways to help, again, we can check for an ID bracelet, take off the mask if they're wearing one, wash your hands. We still want to protect them from possible hazards. So any type of the seizure, we want to move desks, chairs, anything that could be glasses, anything that could be sharp or further injure the person. After the seizure, remain with them until they're aware of their surroundings and they're fully conscious at that point. Again, because they could go into another seizure, we want to make sure that their shallow breathing stops and they're having normal breathing. And we want to provide emotional support, reminding them, hey, you're okay, everything's fine. Don't be afraid, different things like that, anything you would do to provide emotional support. And then we'd like to document what we saw during that seizure, just to make sure that that's normal for that person. That'll be really helpful for them and their neurologist. So being able to document what you see would be great, even if it's just a short little text or note to them that they can give to their parents or their neurologist. So when is it a medical emergency? So like we said earlier, not every seizure is in need of an ER visit. It's a brain disorder. By the time they get there, it's going to be over, and it's kind of a waste of time. But these are the reasons why they should definitely go to the hospital. So if it's their first time seizure and there's no medical ID and no history of seizures. So if you don't know this person, if you're just like walking in the mall and you see someone drop and have a seizure, they should definitely call 911, have someone come evaluate them. Once they're out of their seizure, they can deny transport if they want to. If their convulsive seizure is lasting more than 5 minutes, typically that is going to create more brain trauma. If it's lasting up to that time, again, we've seen people who their seizures last that long. It's just very dependent on the person. So if you don't know them, go ahead and call and get them evaluated. If they're having repeated seizures without regaining consciousness, or those cluster seizures, and you don't know that to be normal for that person. More seizures than usual or change in type. So if you know a person that typically has the absent seizures, so just like the blank stares for a couple seconds, but then all of a sudden they're having the convulsions or the tonic-clonic seizures, obviously something has changed in their brain, and if you don't know them to have that type, they definitely need to be seen by their neurologist to figure out what's going on that's different in the brain. If the person is injured, so if they have a fall and they hit their head, which is very common, or if they maybe like twist their leg wrong or land on their arm funny, if they have diabetes or if they're pregnant, they should definitely get checked out. Don't want them to, got to check the insulin levels and check the baby. If the seizure occurs in water, 10 out of 10 times they need to go to the hospital, make sure that no water got swallowed into their lungs. So they got to be evaluated for that. And again, if their normal breathing doesn't resume, so if they're still having that really shallow breathing or start having like the hyperventilation or like a panic attack, they'll want to get checked out because we don't want that to go into more seizures. One thing I did want to talk about that's not really well known about epilepsy is the post-ictal state. So this is the time after a seizure. So if they've had a seizure where they're probably not feeling well. So although there's going to be those physical reactions to their seizure, there's also going to be some mental ones. This time, even if they're having just the complex partial seizures or the simple partial seizures, this time can last only a few minutes to a couple of days, just depending on the person. So they could have headaches, be nauseous, weakness, just really tired, or other physical reactions. They can also have a change in their mood, cognitive abilities, and their behavior. So my one client who had the seizure in the community with the police officer, for instance, his post-ictal state lasted a couple of days. When he was not in his post-ictal state, or just as he normally is, he is a completely fantastic person, lovely, really sweet, funny, like big smiles, wants to talk with you, very people person. But after he's had a seizure, it was very evident that he had one because he was difficult. He would be really moody, give you one-word answers, give you really nasty looks. So it's really important to know this and be cognizant of that. you do know somebody who has, especially the tonic-clonic seizures, that's when you really see these long-lasting postictal states typically. Just to be proceed with grace. Just know that they're working through that. Their body's working through that, especially cognitive abilities. If they're in school, working with teachers, taking notes, making sure that they're going to be getting all the information would be helpful. I had another client who would have seizures while she slept that would affect her memory pretty badly. So if she would call me and be like, hey, do we have an appointment coming up? That would tell me that she had had a seizure recently because she could not remember when our appointments were. So we'd move forward with that. So when she'd come in, we'd put a note in her calendar so that way it would go off when it was time for her to have an appointment. So just working with them, just figuring out what works best for them. There might need some modifications if they have a pretty brutal postictal state. So just something to keep in mind when you're working, or if you have family with a long-lasting postictal state. Again, so secondary aid, we just have someone stay with them, provide emotional support, and then again, don't offer them any food or drink until they're fully aware. So what's really great in the school system now are these seizure action plans. There was a new law that passed in July for Ohio, which requires these to be filled out by guardians and the neurologist. And it tells the school exactly what to do in the event that that student has a seizure. But these are also great for people living with epilepsy who may have jobs or like if they're seeing counselors or really anywhere they could provide this information without having to have an awkward conversation, because not everyone likes talking about their epilepsy diagnosis and what happens. So easy way to tell them what to do without having an awkward conversation for some. But it tells you exactly what to do. It goes over potential triggers of seizures, their patterns, what they typically look like, for how long, their standard level of care, so what's normal for them and what to do during that time. When it's time to provide rescue medications, we'll get into that in just a little bit. And then when it's time to call 911, when it's time for them to go to the hospital. So really great information to have, especially in the school system, or if you're at work, helps take away that panic and that stress of not knowing what to do, because this will just provide all of that information for them. So very helpful. These are our seizure action plans. These are on our website. You can download them for free. Just go to our website and it'll immediately download. I think Children's Hospital has their own. I'm sure UC or Ohio State, they have their own. Schools even have their own seizure action plans, but they're all the same. We just like our visual aids on ours. So if you like those, feel free to download those for free. Okay, so the rescue medications I talked about, we're going to get into those just briefly. These are approved as an acute treatment, which means that the medicine is given at the time of the seizure or during periods of frequent seizures. So these are not going to be used daily. This is not an anti-seizure medication. This is only used in the event that a seizure is occurring. These are very effective in treating cluster seizures, so when they're going from one seizure to another without regaining consciousness, or that's specific to that specific person's patterns. So not everyone with epilepsy is going to have a rescue medication, but these are a great thing to have, just like an EpiPen. So if you were to have an allergic reaction, you'd use an EpiPen. They work very similarly in just stopping that seizure pretty quickly. So that's what we'll get into just briefly, what these look like. So the first one and most invasive is the diazepam rectal gel, also known as Diastat. This is a rescue medication that gets injected through the rectum. Again, this is very invasive and obviously very traumatic for everyone involved. So not only the person that's receiving it, but the person who's administering it. When I worked at the kids camp, I helped one of our kiddos climb up to go zip lining. So I was climbing through a confined space with her and had this on me in case she had a seizure going up the going up the treehouse. I was terrified that I'd have to use this suspended in air. Luckily, she got to go down the zip line and was so excited and happy, but I was stressed. So I get that this can feel difficult to or overwhelming to somebody who'd have to administer it. But just like with the mental health medicine, if it ain't broke, don't fix it. So some people, they know that this is going to work in an emergency situation. I definitely don't blame them for still using it, but there are way less invasive options now on the market that I'm about to show you. So this is Valtoco. It is still the diazepam, but it is a nasal spray. So if you've ever taken any Narcan trainings, this works exactly like Narcan and looks pretty similarly to Narcan. This is just a spray that gets sprayed up one of the nasal cavities. Obviously, this can differ in dosage. It could be maybe 1 or 2 of them, depending on the person. But this is what it looks like. This is approved for people ages 6 and up. So not only children, but adults as well. And it is very effective. It stops the seizure pretty quickly. And the only side effect we've heard is that it tastes bad. So I think that's a pretty livable side effect. Again, these aren't used in place of anti-seizure medications. These are only used during the seizure. And both of these types of rescue medications are approved for non-medical professionals to administer. So if you were to come in contact with someone with this, you are allowed to do that. But if you don't feel comfortable, obviously just wait for EMS to arrive and they'll be able to administer that for you. But just to know what they look like is great, especially if you know someone with epilepsy. Another one, it's just like Valtoco, it's just another brand. It's midazolam. It's still a benzodiazepine, and it's administered through the nasal cavity, just like Valtoco. The only difference is that this is approved for people ages 12 and up. So that's the only difference. Another option for treatment is the vagus nerve stimulator, or VNS. This is a device. It works very similarly to a pacemaker, if you're familiar. It's implanted just under the neck, or underneath the left collarbone, gets attached to the vagus nerve that goes up to the brain, and just sends electrical pulses to the brain regularly. But in the event of a seizure, there would be a magnet that gets swiped over the device that would send the electrical activity up to the brain, stopping that seizure. So pretty effective for people who have the focal seizures, or the type that only affects part of the brain. So you may come across someone with this. The magnet will most likely be secured around their wrists, or there may be a necklace, but typically it's going to be around their wrist. But again, it works just like a pacemaker, just a 1-2, putting the magnet across it for 2 seconds, and then that's about it. We have videos on our website if you'd be interested in learning how to administer any of the rescue medications, as well as how to use the vagus nerve stimulator. We have different tools and resources on our website. We have the seizure action plans, as well as the rescue medication videos, but we also have posters if you'd like to download them. We have them in English and Spanish. It tells you what to do for the tonic-clonic seizures or the focal seizures. You can download them, or if you want to contact me, I can mail them out to you or bring them to you. It doesn't matter to me, but we're happy to provide this for you. Okay, so here's all of our information. There's our address and our phone numbers, as well as our website. If you need any additional resources, you can go to our parent company, the Epilepsy Alliance America. They have pretty much all of our resources that are available online as well. I guess we can open this up to questions.
Awesome. Yeah, thank you. I know we have just a couple minutes left, and a couple questions that came through during the presentation and a couple that were pre-submitted. So let's go ahead and jump into those. I want to try to get to as many as we can. Yeah. The first one came through the chat. It says, is it possible to have a seizure due to carpal tunnel syndrome? Due to carpal tunnel syndrome, carpal tunnel seems to have possible symptoms extending all the way to the neck.
That's really interesting. I'm not familiar with that, but that's definitely something I can look into. I'm not sure. unfortunately, I don't know the answer to that.
Our next question came pre-submitted. It says, my wife recently had a series of seizures and is now in KEPPRA. There is a driving restriction for 90 days in Kentucky. Is there any restriction in Ohio?
So I'm assuming, is that Keppra, the anti-seizure medication? I'm thinking.
Oh, yes. Yep. Sorry.
Yeah, that's okay. Yeah, typically with trying to find new medications, there probably is a restriction. The driving is really interesting. I just looked this all up recently and I don't know because the DMV will tell you one thing and the law tells you another. Most of it is going to be dependent on their neurologist recommendation. When I was a probation officer, we would always tell people if they had a seizure, there is a driving restriction of 6 months. So they have to go 6 months without having another seizure. But the law doesn't necessarily state that. So it can be really confusing. I would definitely just consult the neurologist. But I know Keppra has a lot of side effects, so that makes sense. I know it's really stressful and unfortunate. So I don't envy that situation. But yeah, that typically they're going to say 3 to 6 months. But the laws are a little gray. It is frustrating.
And then we'll go ahead and end on this question, pre-submitted as well. It says, what is the most important thing to remember when someone is having a seizure?
I would say to turn them on their side. If they're having the tonic-clonic seizures, it is very important to get them on their side. That's what's going to protect their airway, as well as protecting their head. I would say those are the two most important for that type. For the complex partial, I would definitely say to not restrain. That would be important as well.
All right, well, that is going to conclude our Q&A session. Thank you all so much for joining us and have a great rest of your day.